Okay, so I have gathered my supplies. I have lotion over here, towels over here. And I've washed my hands. So I'm gonna just introduce myself. Hi, my name is Claire Egler. I'm a student with the Vincent's Physical Therapist Assistant Program. Could I please get your full name and date of birth?
Kathy Egler, 9/17/66.
Okay. All right. So today I'm just gonna perform a couple massage techniques on you. So essentially, you're just gonna get a free massage today. Is that okay with you?
Yes.
Okay. All right. So first thing I'm gonna do. First to start, 6 indications for why you would perform a massage on the patient. Firstly is if they have pain, trigger points, decreased range of motion, Raynaud syndrome is a common one, as well as tendonitis and headaches can all be improved via massage therapy. 6 contraindications for why you would not perform massage therapy on a patient would be if they have cellulitis, infection, arteriosclerosis, if they have an acute injury, if they have a thrombus, or if they have an embolus, and just to keep them aware of that. So first thing I'm going to do is check her skin, make sure that there's no cuts, abrasions, any sort of, any area that I shouldn't be massaging over with those contraindications. Everything seems to be fine here. There doesn't seem to be any bruising or anything. So I'm going to go ahead and get started. So first thing I'm going to do is make sure that she is properly positioned as she is. We do have a pillow to properly support her head as much as we can. It is a kitchen table. So, let's see here. Oh, and then I'm going to drape you, if that's okay with you today.
Yes.
Just to keep the lotion off of your pants here. Okay, I'm just going to pull that down a little bit. Okay. So, I have orange ginger and eucalyptus spearmint. What would you prefer?
Orange ginger.
Okay, perfect. Revitalizing. So let's do this here. I've taken off my rings so they don't scratch her up or anything, and I'm just gonna warm up the lotion in my hands by massaging them together here. So probably got too much there. So first thing I'm gonna do is some effleurage, which is just going forward and back, really gently, not really trying to put too much pressure. Just working on that circulation, getting the blood moving. Just going up and back down. I'm going to slow forward motion here. Does that feel okay?
Yes.
Okay. If you want me to press harder, please let me know. I can press harder, I can press lighter.
It's good right now.
And we're trying to keep the speed consistent as well as the pressure. Otherwise, we kind of ruin that relaxation portion of it. And normally I would probably have the table a little lower, but given the circumstances, I'm just going to keep it. Obviously I can't move it, so better body mechanics could be used, I suppose. Especially with the chandelier. Okay, so then the next thing we're going to do is some petrissage, and that's just kind of where we're kneading and rolling and lifting. So I'm actually going to dry my hands off a little bit because there's a lot, and you don't really need a lot of lotion for this. Actually, it might be better if you don't have as much, so I'm going to take a little bit of that off. Okay. Alright. Yep, so I'm just going to lift and kind of go lifting up where those muscles are with our hands, our palms, and our thumbs here, our fingers. Feel okay?
Yeah. Feels good.
Please be honest and tell me if it doesn't.
No, feels good.
Okay, so then the next thing we can do here is some tapotement. So that includes a couple things like tapping here. So we'll just kind of tap around, not too briskly, but not too forcefully. And this just kind of, again, increases that circulation there. Just slightly tapping there. Go to the other side. And we're trying to do it again with the same speed, same intensity, pressure, I guess, just to make sure that we're not being too light and then too heavy, or so. And I'm trying to keep a rhythm, but I have a lot to learn with that. Not very rhythmic in my hands, I guess. Okay, so then we can also do some cupping really quick, which is here like this. And this is just kind of cupping your hands, like kind of in a C here, and just trapping that air inside. I'm just doing it really lightly. Does that feel okay?
Yeah.
And you kind of hear that like popping sound, and that's just the air being trapped. Okay, and then the other one we can do is hacking, which is your normal, what you stereotypically see on TV and stuff, which is just short, brisk blows, just kind of using the pinky and the older side of my hand, so that we're just kind of massaging out those muscles. And this is generally, we're going to do that perpendicular with the muscles on the back here, or wherever we're doing it. Again, this should be rhythmic. Again, I have more to learn with this. I'm not very good at it. And it should probably be a little faster than that. I'm just trying to get the rhythm down. Okay. And the last one for tapotement would be some slapping, and we're not, smacking them. Just a light slap, just a little pat, kind of. Again, just working on that circulation of the blood there. Does that feel okay?
Yep.
I'm just making sure that we're doing this long enough for each one. Alright, so that was our first three, and the last two here. So the first one is going to be vibration, and we're just taking the muscles here, and we're just very gently kind of shaking our hand back and forth, trying to shake out those muscles, kind of. These can be short vibrations, or they can be a little bigger, kind of like rocking. But generally you want to keep them pretty small, I guess, just to make sure, depending on what muscle group you're working on. That feels okay?
Yes.
And we are starting to get a little bit of redness just from where I've been poking around. And that is normal, so long as there isn't any severe pain with any of that. That is okay. And then the other one we're going to do is friction. So this is kind of what you stereotypically think of So this is kind of where you find a trigger point and you, or a tight muscle, and you just kind of slowly work your thumb or your fingers around in a small circle. So I'm gonna a little bit of lotion because this one might hurt a little bit as it is friction. So it's, it's skin on skin there. So just put that in there. Yep. Just looking. Make sure we're working around that spot. And this is important not to be on the spine. Whenever you're doing this, you don't want to be pressing all on the spine. Again, you can do this with your fingers, or you can do it with your thumb. Is there a specific spot that's hurting today? Is it down here a little better, or would you like me to stay up here?
Stay up there.
Okay. Get a little bit more lotion. And depending on the kind of lotion you have, it depends on if you're going to want to do more or less lotion. If you have the fray up, you won't need that much. This lotion is more moisturizing lotion, so it's going to get dissipate, I guess, a little faster. So that's your normal friction there. And then we're going to do transverse friction, which is kind of like when you strum a muscle, kind of like a guitar string. So she has this tight muscle running here in the back. I believe that's probably one of her rhomboids here. So I'm just going to kind of go back and forth perpendicular to where that muscle is, since it runs that way. Does it feel okay?
Mm-hmm.
Is the pressure okay? Okay, so we're going to finish off with some ethyl rod real quick, just get you a little more relaxed. And all of that felt okay?
Yes.
Okay, so that is it. Again, I'm just going to dry her off here and then make sure that she's feeling okay, and then we'll be good to go.